Hi, what's up? It is from the Clinical Insight Academy. Today, we'll have 20 questions regarding tuberculosis. Part 1, Foundations and Transmission. Question 1, which type of organism causes tuberculosis? Which type of organism causes tuberculosis? A. Virus. B. Bacteria. C. Fungus. D. Parasite. The correct answer is B. Bacteria. The causative agent for tuberculosis is Mycobacterium tuberculosis. Question number 2. How is the TB infection primarily spread? How is the TB infection primarily spread? A. Touch. B. Water. C. Airborne. D. Food. TB is an airborne disease, so choice C is the correct answer. Question number 3. The primary organ affected by TB is A. Heart. B. Lung. Which organ is primarily affected by TB? A. Heart. B. Lungs. The correct answer is B. Lungs. Lung is the primary organ affected by tuberculosis. Question number 4. Features of latent TB. What is the feature of latent TB? A. Contagious. B. No symptom. The feature of latent TB is it is a symptomatic stage and non-contagious state. Okay, the feature of latent TB is it is asymptomatic and non-contagious. So the correct answer is B. No symptoms. This phase of tuberculosis has no symptoms and it is non-contagious. The latent phase of tuberculosis is non-contagious and asymptomatic. The correct answer is B. Question number 5. Is a person with active TB contagious? Is a person with active TB contagious? A. Yes. B. No. C. Sometimes. D. Never. Yes, a person with active TB contagious. A person with active TB is contagious. The correct answer is A. The most common lung TB symptoms. The most common lung TB symptom. Which one is the most common lung TB symptom? A. Rash. B. Cough, greater greater or equal to 3 weeks. C. Hair loss. D. Blindness. The correct answer is B. Cough. And its duration is greater or equal to 3 weeks. Now, let's proceed to part 2. Before this, I kindly ask you to prescribe the channel, as it is a new channel. So we politely ask you to prescribe and like and share the video. Thank you. Now, let's dive into the next part. It's regarding recovery and prevention. Question number 7. Can tuberculosis be cured? Can tuberculosis be cured? A. Yes. B. No. C. Only in labs. D. Perhaps. The correct answer is A. Tuberculosis is curable if it is spotted early. Question number 8. The standard treatment duration for TB is, or how long is the standard treatment duration for tuberculosis? A. 1 week. B. 1 month. C. 6 to 9 months. D. 5 years. The correct answer is C. The standard treatment duration for tuberculosis is 6 to 9 months. It is commonly 6 months, but if the patient have a relapse, it can proceed to 9 months. So 6 to 9 months is the standard treatment duration for tuberculosis. Question number 9. What is the meaning of MDR-TB? A. Multi-drug resistant. B. Mild dose recovery. This is so simple. A is the correct answer. MDR-TB is multi-drug resistant TB. Question number 10. What is the common TB vaccine? What is the common TB vaccine? A. BCG vaccine. B. MMR vaccine. A. BCG vaccine is the correct answer. Then now let's proceed to the next part of questions, true or false knives. Please guys, I would like to ask you to prescribe the channel, to like and share the channel. Okay. Question 11. Is TB viral? Is tuberculosis viral? No, it is not viral. It is a bacterial infection. It is a bacterial infection caused by Mycobacterium tuberculosis. So tuberculosis is a bacterial infection. Question number 12. Is shaking hands spread the disease? Is shaking hands spread tuberculosis? No, it does not spread by handshaking. It spreads by air droplets, breathing, and or it is an airdrop disease. Question number 13. What is sputum test? What is sputum test? B. PHLEGM. Phlegm. Question number 40. Question number 14. What does a positive skin test indicate? A. Exposure. B. Immunity. C. Cure. D. Allergy. A positive skin test or a positive skin test indicates that the person has exposed. It indicates an exposure. So the correct answer is A. Question number 15. Where does extrapulmonary TB occur? Where does extrapulmonary TB occur? A. Lungs only. B. Outside lungs. C. In the hair. D. In the eyes. B is the correct answer. An extrapulmonary TB occurs outside of the lung. Anywhere outside of the lung is called as extrapulmonary TB. Critical safety factors, another question. Question number 16. Why we finish medicines? Why do we finish medicines? What we have been prescribed by physicians? It is to prevent drug resistance, okay? To prevent drug resistance. Question number 17. What is night sweat? What is night sweat? A very common symptom of tuberculosis. Night sweat is a very common, the commonest symptom of tuberculosis is night sweat. Question number 18. What is the highest risk? People with weak immune system are at higher risk, okay? People with weak immune system are at higher risk. For example, HIV infected people are very vulnerable to tuberculosis. Question number 19. What is DOTS? DOTS is direct observing treatment. It is observed treatment. We will, for the first 2 months, we will give the patient directly with our hands the drug, okay? That is DOTS. In the intensive case, in the intensive phase of treatment. Question number 20. What about the outcome? TB can be fatal if untreated. It can be fatal if untreated, but it can be cured if treated. Thank you guys. I would like to ask you to subscribe the channel. Thank you.